And the patterns of association, when we've looked at it, about obesity, weight loss and mortality are the same across the world, but there is a stronger association between breast cancer here in Asia. And overweight and obesity in red account for 14% of all cancer deaths in men and 20% in women. And these are the cancers associated with obesity in the New England Journal a couple of years ago, and they're increasing, you know. Esophagus, gastric, colon and rectum, liver, gallbladder, pancreas, postmenopausal breast, uterus, ovary, renal cell, kidney, meningioma, thyroid, and multiple myeloma. So there's increasing cancer incidence with obesity, and that'll be in every country. It occurs in children as well, and obesity increases the risk of dying from cancer, especially in women. Why? Well, it may be the diet. It may be hormone changes, because the adipocytes metabolize steroid hormones, lower testosterone in men, particularly due to sleep apnea, insulin resistance, because insulin is a growth-promoting factor, adipokines, or it may be metabolic changes and therefore function of cells. Cancer with weight loss, cancer is reduced by death from cancer in the surgical group. This is bariatric surgery was reduced by 60%. In the Swedish obese study, a 0.71 hazard ratio for cancer for the surgical group, and this was again in the New England Journal a couple of years ago. On the basis of the available data, the absence of excess body fatness lowers the risk of most cancers. In addition, causal cancer preventive effect of intentional weight loss. So further issues with, and this is I bring this up because I think this is really interesting. Does weight loss prevent cancers? Probably, and we need to look at that when we're doing studies. But there are a whole group of cancer survivors whom we forget about. And how much is obesity in this group? Well, cancer survivors actually are fatter than normal. And does this contribute to the return of cancer? And does weight loss prevent recurrence? So we're starting some secondary prevention studies with colon cancer and endometrial cancer to see if we can get weight loss and prevent recurrence. I think it's important. What about stigma? Well, we've got failed in stigma, large people. So this is the British Prime Minister. Questions of individual lifestyle, obesity, smoking, alcohol abuse, diabetes, sexually transmitted, put them all together, are not public health problems. Because they're people with weak will, aren't they? And doctors in the States, this was a few years ago, looked at their patients and they thought they were unattractive, ugly, non-compliant and weak-willed. What was the cause of well, they're pretty good. Physical activity, overeating, high-fat diet, genetics. Okay, lack of willpower came into it though. And we've got to get rid of that because it is a disease that has a genetic cause in our environment. So health professionals stigmatise their patients. The general public certainly does. We do it in images. We do it in, and that's why I like this image. I think it's a good one. We do it in education. So if you're obese, we've just published that women particularly who are obese, get lower marks at university. And that's true across all education. It's true in jobs, and it's true in personal life. Men who are obese are divorced more, for example. And there are two types of images, and we've got to start using respectful images rather than the big bottoms and the big bellies. We need to start showing people with obesity in normal situations so that they are normal, but they do have a problem. You know, there usually is a big McDonald's cup or something, you know, in these pictures.